If you're somewhere between 60 and 80 years old and you can still do these 5 things, you are not just aging well for your age, you are actively protecting the thing that most people quietly dread losing more than almost anything else, and that is their independence. Not their memory of names, not their eyesight, not even their heart health in isolation. Independence, the ability to live in your own home, make your own decisions, get yourself dressed, drive to see your grandkids, and never have to ask someone else for permission to move through your own life. I'm Dr. Olivia Brooks, a board-certified anesthesiologist, and one of the strangest parts of my job is that before every single surgery, I have to make a judgment call about a patient's physical reserve. That means I'm quietly evaluating how strong their heart is, how efficiently their lungs are working, how easily they can move their own body, and ultimately, how much stress that body can absorb without falling apart. This isn't guesswork. It's one of the most important predictors of how someone will do, not just during the operation, but in the weeks and months of recovery afterward. And over more than 20 years of doing this, I've watched the same scene play out again and again. 2 patients, both in their early 70s, both scheduled for the exact same procedure. One of them walks into the pre-op room, hops up onto the table without any assistance, and is cracking jokes with the nursing staff while we get her IV started. The other patient, same age, same diagnosis, needs 2 staff members just to help her onto that table, and she's visibly anxious about the entire process before we've even started. Same birth certificate, 2 completely different bodies, and the gap between those 2 women isn't random luck. It isn't just genetics either, although genetics plays a role. In the vast majority of cases, that gap comes down to a handful of physical abilities that either got maintained over the decades or quietly slipped away because nobody was paying attention to them. So in this video, I want to walk you through 5 specific abilities that you can test for yourself right now in your own living room. No equipment required for most of them. Each one tells us something very specific about what's happening inside your body, and by the end, you'll know exactly where you stand and exactly what to do about it if you're not where you'd like to be. Let's start with the first one, and that is your walking speed, sometimes called gait speed in the research world. Researchers have actually started calling this a vital sign, which puts it in the same category as your heart rate, your blood pressure, and your temperature. That's a bold claim for something as simple as how fast you walk across a room, but here's why they say it. Walking, when you really break it down, is one of the most complex things your body does. It requires your heart and lungs to deliver oxygen efficiently. It requires your leg and core muscles to fire in a coordinated sequence. It requires your joints to move smoothly without pain. It requires your inner ear and your eyes to keep you balanced. And it requires your brain to process all of that information in real time and adjust with every single step. When any one of those systems starts to weaken, even slightly, walking speed is often the very first place it shows up, sometimes years before a blood test or a scan would catch anything. I've had patients tell me, "Dr. Brooks, I feel fine, nothing's wrong," and then I watch them walk down the hallway to the exam room, and I can already tell something is off before we've even discussed their symptoms. That's how sensitive this measurement is. Large studies that have followed thousands of older adults for years at a time have consistently found that people who maintain a faster walking pace live longer, and this holds true even after researchers control for other health conditions like heart disease or diabetes. A comfortable walking pace of roughly 3 feet per second, which is a little faster than a casual stroll, has repeatedly been associated with better long-term outcomes. When that pace drops significantly below that, it tends to correlate with a higher risk of hospitalization, falls, and mortality. Here's how you can actually check this yourself without any special equipment. Find a hallway or a stretch of sidewalk that's about 10 feet long, and just time yourself walking it at your normal, comfortable pace, not rushing, just your everyday walk. Do the math on feet per second, and you'll have a rough personal benchmark. And if you find that your pace has slowed down over the last year or two, that's not a reason to panic, it's a reason to act. Walking speed is one of the most trainable abilities on this entire list. Regular walking, especially incorporating short intervals where you deliberately pick up your pace for 30 to 60 seconds and then return to normal, has been shown to measurably improve gait speed within a matter of weeks. It doesn't require a gym membership, it requires consistency. The second ability I want you to think about is something that genuinely surprises most of my patients when I explain it, and that's grip strength. On the surface, it seems like such a small, specific thing to measure. Why would how hard you can squeeze something tell us anything meaningful about the rest of your body? But grip strength has turned out to be one of the most useful proxies we have in medicine for your overall muscular strength and what physiologists call your physiologic reserve, essentially how much extra capacity your body has stored up in the bank for when things go wrong. Here's the physiology behind it. The muscles in your forearm and hand don't exist in isolation. Grip strength correlates remarkably closely with strength throughout your entire body, your shoulders, your back, your legs, because muscle mass and neuromuscular function tend to decline together as a system, not in isolated pockets. When your grip weakens, it's usually a signal that broader muscle loss, something doctors call sarcopenia, is happening elsewhere too. Research has linked low grip strength to a higher risk of falls, slower recovery after illness or surgery, longer hospital stays, and yes, even reduced life expectancy. It's remarkable that something so simple, something you could measure with an inexpensive hand dynamometer, or honestly, even just by noticing how hard it is to open a stubborn jar lid, gives us this much information. I remember a patient, a retired school teacher in her late 60s, who came in for a routine procedure, and during our pre-op conversation, she mentioned, almost as a throwaway comment, that she'd started struggling to open jars and had switched to buying pre-opened containers. That small detail told me more about her overall physical resilience than most of her lab work did. And sure enough, her recovery afterward was slower than we'd hoped, exactly the pattern the research would predict. The encouraging part of this equation is that grip strength and the muscle mass it represents responds beautifully to resistance training at almost any age. You don't need to become a bodybuilder. Simple things like carrying your own groceries instead of using the cart to lean on, using inexpensive resistance bands a couple of times a week, doing basic bodyweight exercises like wall push-ups or seated leg presses, or even just squeezing a soft rubber ball or stress ball repeatedly throughout the day can move that number in the right direction. Research has shown measurable improvements in grip strength with as little as 2 sessions of resistance work per week, and those gains show up in a matter of months, not years. The third ability on this list, and I'd argue one of the most important, is your cardiopulmonary fitness. In plain language, this is how efficiently your heart and lungs work together to get oxygen out to the muscles that are actually doing the work, whether that's climbing stairs, gardening, or just walking briskly to catch up with your grandkids. In the research world, this is measured as something called VO2 max, and if you happen to wear a smartwatch, there's a good chance it's already estimating this number for you without you even realizing it. What's remarkable about VO2 max is that in some large studies, it has emerged as one of the single strongest predictors of longevity that we currently have in medicine, in certain analyses outperforming even well-established risk factors like smoking status or a diabetes diagnosis. That's a striking statement when you think about it, because we've spent decades building public health campaigns around smoking cessation and blood sugar control, and yet how well your heart and lungs deliver oxygen may matter just as much, or more. The reason this makes sense physiologically is that a body capable of delivering and using oxygen efficiently simply has more reserve to draw on. When you get a respiratory infection, when you need surgery, when you're recovering from a fall, or even when you're just trying to keep up with the everyday demands of life, that oxygen delivery system is working overtime in the background. The stronger it is, the more buffer you have. You don't need a laboratory VO2 max test to get a rough sense of where you stand. A simple home version is what's often called a stair climb test. Time yourself walking up 2 flights of stairs at a steady, comfortable pace, and pay attention to how breathless you feel afterward, and how quickly your breathing returns to normal. If you can do it without stopping, without significant breathlessness, and your breathing recovers within a minute or 2, that's a good sign. If you're gasping and it takes several minutes to feel normal again, that's useful information too. Not a reason for alarm, just a reason to start building this system back up. The genuinely good news here is that cardiopulmonary fitness is one of the most trainable, responsive systems in the entire human body, and that remains true even when you start later in life. Regular aerobic activity, brisk walking, swimming, cycling, even dancing, anything that consistently elevates your heart rate for a sustained period, produces measurable improvements in VO2 max within weeks. Studies on adults starting exercise programs in their 60s and 70s have shown meaningful gains in cardiovascular fitness, in some cases rivaling the improvements seen in much younger participants. Your heart and lungs, in other words, are still listening, no matter what your age is. The fourth ability I want to talk about is one that connects directly to a fear I hear from nearly every older patient I meet, and that fear is falling. Balance depends on a remarkably intricate coordination between your inner ear, which handles your sense of spatial orientation, your vision, the sensory nerves in the soles of your feet that tell your brain exactly how you're positioned relative to the ground, and the strength in your legs, core, and ankles, all communicating with your brain in real time, dozens of times per second, without you ever consciously thinking about it. As we age, each one of those individual systems can quietly decline, sometimes so gradually that you barely notice it happening, and balance is very often the first place where those small declines become visible. This matters enormously, because falls aren't simply an injury risk to be managed after the fact. A serious fall in your 70s or 80s is one of the single most common triggers for a permanent loss of independence, whether that means a hip fracture that leads to a long hospital stay, or a fear of falling that causes someone to stop leaving their house altogether, which then leads to further muscle loss and an even higher fall risk down the road. It becomes a cycle that's genuinely difficult to break once it starts, which is exactly why catching balance decline early is so valuable. Here's a simple way to check your own balance right now. Stand near a wall or a sturdy piece of furniture for safety, and try standing on one leg with your eyes open, and time how long you can hold that position comfortably before needing to touch down or grab something for support. There's no single perfect number that applies to everyone, but tracking this over months and years gives you a genuinely meaningful, trackable data point about how your nervous system and muscles are aging. If you find that your balance isn't where you'd like it to be, the response is remarkably straightforward. Balance training, things like practicing that single leg stand a little longer each week. Tai Chi, which has an enormous amount of research behind it specifically for fall prevention in older adults, or simple stability drills like walking heel to toe in a straight line. All of these produce outsized improvements relative to how little time they take. Many balance programs show meaningful reductions in fall risk within just a few months of consistent practice, a handful of minutes a day. The fifth and final ability I want to walk you through is one that might sound unusual at first, but stay with me, because the research behind it is genuinely compelling. It's your ability to get up off the floor from a seated position without using your hands or your arms for support at any point. This is a real validated tool used in aging research, sometimes referred to as the sitting rising test, and it's essentially a full-body stress test disguised as a completely ordinary movement. Think about everything that has to work correctly for you to sit down cross-legged on the floor and then stand back up without touching a hand down. You need leg strength to push your body weight upward. You need core strength to keep your torso stable throughout the movement. You need balance to avoid tipping over as your center of gravity shifts. You need flexibility in your hips, knees, and ankles to get into that low position in the first place. And you need coordination to sequence all of those muscle groups together smoothly rather than in a shaky, disjointed way. It's an extraordinary amount of physical demand packed into a movement that most of us performed effortlessly as children without a second thought. Researchers who have followed adults over many years using this exact test have found something striking. People who were unable to complete the sitting rising test without using their hands or arms for support had a meaningfully higher risk of death over the following years compared to those who could do it cleanly, even when researchers adjusted for age and other existing health conditions. That's a sobering finding, but I want to be clear about what it actually means. It's not that the movement itself is magically protective. It's that the movement is an incredibly efficient window into whether your body still retains the combined strength, flexibility, balance, and coordination that everyday independent living genuinely requires, whether that's getting up from a low chair, picking something up off the floor, or recovering your footing after a stumble. I want to be equally clear about the flip side of this, because I don't want anyone listening to this and feeling defeated. If you tried this right now and couldn't do it, that is not a verdict on your future. It's simply useful information about where you're starting from today. This ability responds to training just like every other item on this list. Practicing the individual components, things like sit-to-stand exercises from a regular chair, kneeling and rising from a kneeling position while holding onto something sturdy, or simple bodyweight squats, gradually rebuilds the exact strength, flexibility, and coordination this movement requires. Many people who couldn't do it at all when they started have regained the ability within a few months of consistent, modest practice. So let's bring this all together, because I think the underlying message here matters more than any single number on this list. Longevity, real longevity, the kind that actually matters to your daily life, isn't mostly about a number that shows up on a lab report or a cholesterol panel, although those things matter too, of course. It's fundamentally about whether your body retains the strength, the speed, the balance, and the coordination to keep doing the things that make your life feel like your own. Whether that's playing with your grandchildren on the floor without needing help getting back up, walking through an airport at your own pace without falling behind, or simply feeling confident and steady on your feet as you move through an ordinary day. The truly encouraging part of everything I've shared with you today is this. Every single one of these 5 markers, your walking speed, your grip strength, your cardiopulmonary fitness, your balance, and your ability to get up off the floor without support, responds to training. And it responds at almost any age, whether you're 60, 70, or 80 years old right now. None of these abilities are fixed. None of them are purely determined by genetics or luck. They are in large part the result of what you choose to do with your body starting today. If this gave you a clearer picture of where you actually stand and where to focus your energy going forward, make sure you subscribe to the channel so you don't miss any future videos, because I'll be covering more of these evidence-based markers of healthy aging in the weeks ahead. And I genuinely love to hear from you, so leave a comment below and let me know which of these 5 abilities you can already do confidently